And the NDC has outlined 10 reasons they believe are key indicators that the Akufo-Addo administration has lost the fight against COVID-19. According to the party, closure of some state institutions, suspension of emergency services at Kolebu, lack of isolation facilities and others show that government has no clue on how to contain the spread of the virus. The NDC is insisting government has been overwhelmed by coronavirus. Now, at its 7th weekly press engagement, National Communications Officer of the NDC, Sammy Gyamfi, asked Ghanaians to hold government liable for the spike in COVID-19 cases.
Number 5. Furthermore, ladies and gentlemen, the significant reduction of testing and contact tracing being spearheaded by the failed Akufo-Addo government is a major setback to our COVID-19 fight. Government's refusal to pay contact tracers their meager allowances, despite Parliament making financial provision for same, has led to the complete abandonment of contact tracing, thereby letting loose the ravaging virus in our communities. Also, our severely constrained testing capacity and shortage of test reagents and other vital supplies, which accounts for the huge backlog of samples waiting to be tested above the Noguchi Center of Medical Research and the Kumasi Center of Collaborative Research, is further exacerbating our failing fight against the virus. Number 7, still giving you indicators that show that our fight against COVID-19 is failing. Additionally, ladies and gentlemen, the lack of isolation facilities to contain our positive cases is very worrying. Currently, most of our hospitals and health facilities are full and overstretched, leading to the suspension of other critical emergency health services, while our ICUs are also getting full. This situation has led to an increase in self-isolation of positive cases, which is undermining our COVID fight, as the evidence shows that voluntary self-isolation, let me take this again. Ladies and gentlemen, this situation where our hospitals are getting full and overstretched and our ICUs are also getting full, that has led to an increase in self-isolation of positive cases, is undermining our COVID-19 fight, as the evidence on voluntary self-isolation show relatively low compliance to safety protocols as compared to mandatory isolation. Number 8, another serious problem confronting us currently is the inadequacy of health personnel to manage our COVID-19 cases, as was recently admitted by the Presidential Advisor on Health, Dr. Insiansari, in the media a few weeks ago, that we have been overwhelmed with our astronomically high positive cases, that we do not have the right physicians and health professionals to even manage, our COVID-19 cases. Ladies and gentlemen, that reflects the dire straits we find ourselves in at this present moment. Also, the inconsistent and doubtful data on our COVID-19 situation, leading to loss of public confidence, is a major problem. The several instances of manipulation of data by government to create a false sense of security instead of reporting the true facts as they pertain to our situation has gradually chipped away public confidence in government's management of the pandemic.